Hi, I'm Caitlin Ben-David. Today I'll be talking about the ASH Physician Scientist Career Development Award and our analysis of a phase 2 trial of natalizumab and steroids as primary treatment for high-risk GVHD defined by biomarkers. Hematopoietic cellular transplantation can cure hematologic malignancies by donor alloreactive T cells. These same donor T cells are also linked with the toxicity of graft versus host disease, or GVHD. It's the primary cause of non-relapse mortality NRM following HCT. Little progress has been made in decades in validating new treatments. Systemic steroids are primary treatment, but often ineffective. And if initial therapy fails, mortality rates are as high as 90%. During GVHD, damaged tissue releases proteins into the bloodstream that can be quantified by biomarkers that are then used to determine risk at diagnosis. Our preliminary data has shown that biomarkers at week 4 post-treatment more accurately predict death than clinical response at week 4, which is currently considered the gold standard. These preliminary data form the basis of my project that will evaluate patients enrolled in a clinical trial based on biomarkers. So what is the study drug natalizumab? Natalizumab is a monoclonal antibody against the alpha-4 component of the alpha-4 beta-7 integrin that blocks T cell trafficking to the GI tract. GI GVHD is a major cause of death and the least responsive to treatment. Natalizumab's mechanism of action presents a novel potential drug for patients at high risk for steroid refractory GI GVHD. We've been analyzing a phase 2 multi-center study of natalizumab plus steroid treatment for high-risk acute GVHD. And patients with high-risk GVHD by biomarkers at onset are eligible to enroll regardless of clinical GVHD severity. We hypothesize that response to 4 weeks of primary treatment will be demonstrated in a significantly higher proportion of clinical trial patients treated with natalizumab and steroids versus matched controls treated with steroids alone. We aim to evaluate the ability of biomarkers and clinical response at week 4 to predict 6-month NRM in trial patients and controls. And then we aim to compare the 6-month NRM of clinical trial patients to controls. We will identify controls in the Mount Sinai Acute GVHD International Consortium, or MAGIC. This is comprised of 23 international centers, over 4,000 MAGIC HCT patients, and 25,000 blood samples. So you might be wondering, what is my current phase of training? Well, I'm a third-year student at Mount Sinai's Patient-Oriented Training and Leadership, or PORTAL, Joint MD Masters in Clinical Research program. Through this, I've been gaining experience in translational research with equal exposure in lab techniques and clinical data. I've also been gaining in-depth training in statistical analysis for this project. I aim to become an independent NIH-funded clinical investigator in the field of pediatric oncology, leading innovative trials in childhood cancers. The ASH-a-Palooza Career Development Award is a $42,000 one-year award that includes trainee support, research supplies, insurance, educational expenses, and meeting attendance. Medical students gain experience in hematology and are mentored by an ASH member. It's open to first, second, and third-year medical students. The 2020 application cycle is now open, and the application deadline for the current cycle is January 15th of 2020. This award has been providing me support to complete a major research project analyzing an innovative phase 2 clinical trial. It's also been providing me invaluable experience in translational hematology research. So what are some important takeaways? GVHD biomarkers are being used to determine treatment. Natalizumab is a potential therapy for GVHD, and the ASH Physician Scientist Award has been making this project happen. Thank you.